All right. So we already talked about tension headaches. Now we're going to be talking about called cervicogenic headaches. Now, these essentially mean cervicogenic means it's coming from your neck, and headache obviously means, headache. So these are similar, these are a secondary type of headache, and they're commonly involved with the upper part of your neck, the three spinal nerves that come from the very, very top of the neck, the joints in this region as well. Unlike the tension type headache, they're not really instigated or caused by pericervical structures, but by the actual myodural bridges connecting the dura to the deep posterior neck musculature. Most common pain triggers include the very top, so C1, C2, and C3 joints. Those are the joints right at the top of your neck here. Oftentimes, one of the most clear diagnostic tests we call the seated cervical flexion and rotation test. Essentially, where we tuck your head down and rotate to the side. You can do that both sides, and that will oftentimes light someone up like a tree that has this type of headache. Essentially, you feel this headache is coming from right there. You just know it's coming from there. Oftentimes, it'll radiate out, sometimes to the side. So similar to the tension headache, the nociceptive signals in these areas in the joints and nerves in the upper part of the neck, they travel into the spinal cord through that dorsal horns in the spinal cord, and they travel up into the trigeminal cervical nucleus. Here, the sensory fibers from the upper cervical nerve roots, they interact with the sensory fibers from the trigeminal nerve. So the nociceptive signals can sometimes be referred into that trigeminal nerve, the sensory distribution as well. It means into essentially the face. Trigeminal nerve, it kind of travels in through the different regions of the face here. So oftentimes, majority of the time, 72% of the time, pain starts in through the back of the neck here, and then it travels upwards. Sometimes it's made worse with neck movement. In fact, most of the time, it's made worse with neck movement. It can last hours, it can last weeks. It's typically not throbbing, and it can be either moderate or severe type of pain. Very common after whiplash type of injury. So if you've been in a motor vehicle accident, or you've been in trauma, or you've fallen, you've hit your head, the pain can really fluctuate in intensity. Sometimes it's really bad. Sometimes it's like okay. Oftentimes it's on one side. So again, typically you feel it here and then it shoots up to the one side. Sometimes though, it can be on both sides. Sometimes you'll get pain down and through the arm and shoulder as well. You're typically not going to get any nausea, no vomiting, no sensitivity to light or sound. And oftentimes there's a history of neck trauma. So you've been in some type of accident, or you've fallen, or someone's hit you in the neck. Something's happened to your neck. Head pain. So usually the pain, again, starts at the bottom of the neck here, and then it travels either sometimes behind the eye, sometimes to the temple, sometimes like a ram horn kind of up above like this. Oftentimes the average onset of these types of problems are at age 40, but I've seen them in everyone from like in their teens and above from there. It's gold standard treatment for this type of problem, similar to the tension type headache, but this is really where chiropractic manipulation really shines. If you have this type of headache, if you get your neck mobilized and manipulated, get those joints moving more appropriately with the chiropractic adjustment, that's going to feel fan-freaking-tastic. Don't do that on your own, please. You'll probably just end up hurting yourself. So go see a chiropractor. They'll help you out with it. Exercise is really important. So take your partner on a walk, go to an exercise class, get moving. Movement is helpful. Myofascial therapy. So if you're to do a little bit of massage, some gentle traction, some stretching in through their neck, that would feel fan-freaking-tastic as well. Sometimes in the office, we'll do some neuromobilization just to promote some mobility in that dura and create some desensitization of those structures to help minimize the pain intensity as well. Sometimes medically, these are treated. Again, I'm not a medical doctor. I'm not saying you should do this. But sometimes they'll give them things such as NSAID, so Advil, ibuprofen, acetaminophen. These don't really seem to help most of the time. Sometimes it numbs it a little bit, but doesn't really get rid of it. So those are the things you can do for your partner if they're having this type of problem. Get moving, need to exercise, do some trigger point work into the musculature, but also get them in to see your chiropractor because they're going to adjust their neck, and that's going to feel fan-freaking-tastic. All right, next we're going to talk about migraines and what you can do to help overcome these migraines and exactly what they are. And we'll see you soon.